Some clinical and surgical procedural variations out of the presented standards are specific particularities of each surgeon.
Plastic surgery is a search for harmony between the interior and the exterior of your body. Therefore, it's up to the plastic surgeon to perform the surgical intervention well, but it's up to the patient to follow up with the special care required by this type of surgery. We count on human intelligence and the use of science, and on the power of a being superior to our human capacities and limitations, that is God Himself. A beautiful facial and body appearance is an inspiration to artists and plastic surgeons searching for the most delicate shapes and contours, which is a challenge to the art that recreates man's perfection. In selecting a plastic surgeon, the hope is that he will be able to restore the shapes and forms you desire for your body. Breast prosthesis surgery corrects breast underdevelopment and repositions sagging breasts by inserting a prosthesis which must be replaced every 10 years. The types of prosthesis used in many countries are smooth textured or polyurethane prosthesis, both using cohesive gels, and saline prosthesis. Sometimes the patient expects a great transformation without taking into account the limits of his own body and of science. During an evaluation, there will be an analysis and discussion of your body conditions, such as skin elasticity, scars, pre-existing skin depressions, and any asymmetries that could interfere with the final result. The doctor will explain the surgical advantages and also the limits of this surgery. For example, the limits of the volume of the prostheses and the possibility of post-implant stretch marks. After a previous evaluation, some complementary tests will be required if necessary, related to the hematological, cardiological, and neurological conditions of the patient. Pictures for study and personalized surgical planning will be part of the medical handbook. Medical consent forms will be presented at the time of the surgical procedure. Before the procedure, the following recommendations will be made. The use of medications such as antidepressants or anti-hemorrhage, anticoagulants, and anti-inflammatory agents, as well as anoretics or diuretics, must be suspended prior to the surgery, according to the time stipulated by the doctor. Colds, flus, or any type of sickness and/or anticipation of the menstrual period must be reported to the medical staff. Smokers will be required to stop smoking before and after the surgical procedure due to the harm caused by smoking, harm that could cause difficulties with circulation and scar formation. You should inform your doctor about any previous complications related to any type of anesthesia or prescription medications. You cannot use any body or facial cream. You cannot use nail polish. The patient must fast from solid and liquid foods, including water, for at least 8 hours before the procedure. Greasy foods and alcoholic beverages must be avoided 24 hours prior to the surgery. It's important that you stay calm before the surgical procedure. In case of anxiety, you should communicate this to your doctor so he can help you remain calm. The anesthesia can be either local or general, at the discretion of the anesthesiologist, who will choose the best option in each case. The surgical time will be compatible with the surgical technique and the type of procedure. Transversely through the nipple, under the nipple, or through the mammary furrow, placing the prosthesis in a subglandular, subfacial, or submuscular position. In some cases, if there is a sagging breast lifting is first required, with the prosthesis placement occurring soon afterwards. The final result is a T, L, or I-shaped scar. These are special cases that require more explanation. In some surgeries, continuous suction drainage tubes are used. Bandages will be used based on the procedure performed. An appointment to remove the stitches will be scheduled based on the method used. Following the post-operative instructions and assuming responsibility for taking all medical prescriptions is very important for a faster recovery and better surgical results. Painkillers will be prescribed in case of pain. In the week prior to surgery, any questions regarding sexual relations, bathing, sleeping positions, driving, and so on will be clarified by your doctor. After surgery, lymphatic draining sessions will be recommended. Also, the use of special kind of elastic stockings to prevent possible thrombosis. Also, silicone strips and ointments may be indicated depending on the needs and healing of each patient. The lack of physical exercise might cause weight gain. Therefore, avoid overeating. Keep in mind that the healing of the scars will take up to 12 months. After this period of time, you will see a definite improvement. Black and blue marks caused by the surgery will gradually disappear, and swelling will gradually diminish, and improved results will be seen 30 days after the surgery. Avoid being in the sun or in very hot places for 3 to 6 months so that the scars, as well as the surgical region, won't become darker, a condition known as hyperchromy. It's important to highlight the risks in any surgery, just as there are risks in any day-to-day activity that we perform, such as driving, traveling on vacation, or being subject to urban violence. Our staff is completely prepared with the best possible resources to help you in case of any allergic reactions, scars, necroses, hematomas, venous thrombosis, and infections. If there is a need for corrective procedures, such as touching up a scar or new repositioning in reference to the original surgery, a new medical evaluation will be needed as established by a previous agreement between the doctor and patient. It's important to clarify that despite being a highly qualified staff, we do not discard the risks of complications in this surgery. We count on the intelligence of man in the use of science, and on the power of a being superior to our human capacities and limitations, that is God Himself. Plastic surgery tries to harmonize the interior and the exterior of your body. Therefore, it's up to the plastic surgeon to perform the surgical intervention well, but it's the patient's responsibility to follow carefully the medical recommendations. This clinic staff will guide you through the pre- and post-operative period, being available to answer any questions that you may have before and after the surgery.